Welcome to Undeniable Proof, a look at what makes VCU Medical Center the top hospital in Richmond. I'm your host, Amy Lacey. For 15 years, VCU Medical Center earned the #1 spot in U.S. News & World Report's annual Best Hospitals rankings. That level of excellence is driven by the core mission to serve all Virginians and beyond.
It's a mission of preserving and restoring health. It's a mission of finding the causes for what people deal with. And it's also about the mission of finding the cures that will bring people to a life that they deserve to live. I think it's no surprise that for 15 years straight, we've been the best hospital in the region. And the really core reason for that is we offer more hope than probably anyone, but we also have a culture of care that's really unmatchable.
We have 15,000 team members inside the health system. It's an enormous number, and every one of them is incredible in the work that they do. And everybody that comes to work here is here with passion, with purpose about taking care of the patients.
We all wake up wanting to do great things every day. And at VCU Health, you get that opportunity. We are the largest safety net hospital in the state. Whether you are insured or uninsured, you get the same care. We serve all Virginians and beyond. So a little known fact, we usually serve people from close to all 50 states and multiple countries every year.
My name's Greg Litz. I'm a retired firefighter from Spotsylvania County Fire Rescue in Spotsylvania County, Virginia. I was diagnosed with prostate cancer, and there's a scale called a Gleason scale that goes from 2 to 10. 10 is extremely aggressive, most likely spreading outside of the prostate. Mine was a Gleason 9, so it had spread. It had spread into part of my pelvis and into one of my vertebrae. So it was very aggressive and moving rapidly. So it was metastatic prostate cancer. I had a major stroke in 2013 where I was seen by neurosurgery at VCU. They went through a surgical procedure and have been followed by VCU neurology since my stroke. So it was kind of, for me, a no-brainer to return to a facility that had, in my opinion, saved my life when I had my stroke. I knew I would be in good hands.
That's what drives us every day. We want you to be healthy. We want you to feel good about your life. And we want you to feel like we're going to be there to take care of you.
Our patients know that we provide them with respect, dignity, and anytime somebody's coming through that door, we assure them they're going to get excellent care. Others simply may or may not have the resources to invest in their infrastructure, in advanced technology. The advanced training that our physicians and our surgeons here, they're world-renowned.
Teams here are nationally recognized in a lot of disciplines. Orthopedics, for example, this is the only Virginia hospital nationally ranked in orthopedics. But there's a lot of other complex work in cancer, certainly with our Massey Comprehensive Cancer Center, in cardiovascular, in thoracic surgery, heart surgery, neurosurgery, on and on and on. The very work that gets done at academic medical centers is done here in Richmond at VCU Medical Center.
Our service, our research and education, clinical care, quality, that is all assumed. But when you're talking about training the next generation of physicians, nurse practitioners, nurses, all of the allied health professionals that we have through the School of Health Sciences, that's a game changer. And then parallel on top of that, when you talk about the research that we're performing, we're not just doing research in a lab. We're doing research at our downtown campus in an urban setting. We're doing research in our rural communities where patients previously would have no access to clinical trials.
Each individual is more than just a set of illnesses. There's a lot that goes into taking care of an entire and whole person. So from a social standpoint, just think about things like housing, food security, transportation, and all the things that come together to make you healthy outside of just your health care. We bring all of those things together, all the things that go into making your life what it should be. And that's the real win. Not only when you can give high-tech care, but also you can do it with high touch as well.
My name is Lisa Johnson, and I work for the best hospital in Richmond, Virginia.
The community at VCU amongst my coworkers is unlike any other hospital I've ever worked for.
I feel like we receive patients from multiple parts of not even Virginia, but honestly, the United States and even the world sometimes. So you see people from all over, and it really makes you realize how special this organization is and the things that we're able to do that maybe others don't do typically.
My name is David, and I work at the best hospital in Richmond, Virginia.
You know, our patients are with us during some of their hardest days, and I appreciate their faith in us that we're going to provide that great care and that compassionate and respectful care, and allowing us to be part of their journey.
Every day at VCU Health, we bring our unwavering commitment and an uncommon approach to healing.
Recovery time about 6 weeks, and
for whatever, for whomever, for whenever. We do our best to explain, to solve, and to fix. We stop at nothing to find answers. We leave the status quo behind to deliver compassionate care to all. As in unrelenting hope, unbelievable joy, undeniable proof. Whoever you are, whatever brings you to us, we are unconditionally committed to helping you live your best life. That is our unending promise. VCU Health.
VCU Medical Center is located in downtown Richmond, but the qualities that make it the #1 hospital extend far beyond this campus.
We have over 70 sites in the greater Richmond and central Virginia area where our care is delivered. We have 45,000 hospitalizations every year, 1.3 million outpatient visits, and the care that's delivered in downtown is also spread to that entire area.
We have our 2 rural hospitals, Tappahannock and the Northern Neck, Community Memorial Hospital in South Hill, Virginia, that have been serving those communities, and it's a complete difference.
Healthcare is a team sport. And so when I think about multidisciplinary care, I come at it from very specific angles. I'll talk about this health hub on 25th Street just a little bit because it's a beautiful thing. It's a marriage between the health system and the university. We have patients, community members coming in here as we look at taking care of the whole individual. So we got the care part, but it's centered around people.
The Richmond area is incredibly blessed to have a facility such as VCU that is a multiple disciplinary medical center that folks go to from all over the Commonwealth.
Because ultimately, it isn't buildings that take care of people. It isn't hospital rooms. It isn't emergency rooms that take care of people. It's the people in those spaces that take care of the people who come to us.
It's significant because it's really a reflection of the people that work here. It's their commitment to what they do. They're passionate. They are uncompromising with the care that they deliver.
The gratitude that we have, of course, extends to our patients and to the families who place their trust in us to do this.
When I look at what's undeniable, I look into the eyes of our patients. When I'm rounding around our facilities, our hospitals, our clinics, all of our different units, the undeniable proof is that you are there taking care of people in sometimes their worst moments and sometimes some of the happiest moments of their lives. And being able to do that in a way that takes care of the whole individual, not just the ailment that they came to see you for.
That's what really makes us #1.
Unwavering commitment, unparalleled care, uncommon compassion. Whoever you are, whatever brings you to us, we are unconditionally committed to helping you live your best life.